Hi, my Red Tribes. Welcome to another episode of Dr. Red Diaries. It's been an interesting journey so far. And today, we're going to talk about something very important, actually. That's my transition from clinical medicine to HMO, or health insurance, as everybody knows it in Nigeria. That's one journey that I'm sure a lot of people are actually interested in or be interested in. Actually, if you want to transition, or the reason why I transitioned, am I even still practicing medicine fully? I'm going to talk about all that in this video. So let's get right into it. Alright, so I think after finishing my house job, moving to Lagos. I worked in a health center for 2 years plus. I managed a health center for 2 years plus in Lagos. And then it started becoming a routine. First of all, I knew that I wasn't going to um do my residency. I knew I was going to move to Nigeria, and I did. And I knew that since I was in Nigeria, I was going to do residency. But I also wanted to make a change. I am still and continue making a change, but I wanted to make a change. I wanted to do something different. I wanted to explore the healthcare system, a different aspect of the healthcare system, like the preventive aspect, the aspect about our health policies, legislative aspect, healthcare regulations. I really wanted to understand and know how those things are implemented, read about the policies, understand how it works, understand how we can even make healthcare accessible and affordable for even an average Nigeria, or a Nigerian below the average economic status. And for me, I knew that I already had the clinical experience. I wanted something more. I wanted the health insurance experience, that's the HMO experience, that's the ability to be able to provide affordable healthcare. This affordable healthcare, premium healthcare, but it's affordable. Good healthcare, but it's affordable and it's accessible. That is the idea of health insurance, actually. So in the year 2020, during COVID period, yeah, I was still working in the health center then. But I think that was part of the things. I've always wanted to know I was going to transition, but I think during that COVID period, it really sparked or reignited my interest and my passion, actually, because I think at one point I had forgotten the reason why I moved to Nigeria. I was just working like every other Nigerian medical doctor, like a zombie. Sleep, wake up, go to work, do the calls, do everything, go back home, like that. No purpose, no fulfillment, because of where and what we found ourselves in. So during COVID, I think, went a little bit, the lockdown had been called off and every single thing. I thought to myself, okay, what more can I do? What more skill can I learn? How can I really start understanding things I want to do? Start meeting people, start exposing myself, expressing myself. I'm really talking about and expressing how passionate I am about healthcare. What do I want to do differently? And then health insurance came up. Health insurance became an option. HMO became an option. So I started reading about health insurance. I started studying about health policy. I read a lot of health policies, especially policies that have been signed and laws and bills that have been signed regarding our health in Nigeria. Yes, if you are a medical doctor in Nigeria and you've not read about the health policy in Nigeria, I would advise you to read it. If I can insert the documents in any of these videos, I will do that. So you take out time to read it. There's so much information out there. Not even for medical doctor. Even if you're interested in healthcare, in the healthcare system in Nigeria, you need to read the policies. You need to understand what is written there. But there are so many things I've heard about laws and things that are supposed to be done in the healthcare system that are actually not being passed in the policy. There's so many things that we are misreading or misunderstanding. There's so many rights that we even have as doctors, or we even have as the people of Nigeria, or we even have as patients that we are not aware of, that are in the policy and we don't know. So it is important to read it have an understanding so you can even know your own rights or your own right to access to healthcare in Nigeria. It is very, very important. So I started reading all those books, reading the documents, getting to understand regulations, how health is being regulated, our NHI right now, and every other regulatory body for hospitals, for healthcare, and how people can easily access healthcare. I was started learning about the average Nigerians, how they access healthcare, out of pocket payments, return, and so many other things regarding health insurance, HMO, or even healthcare and health policies in Nigeria. And it really caught my attention. Why? Because I realized that a lot of people are not aware of these things. A lot of people are not educated on this part, and that's the idea of this podcast, to really educate us about the healthcare system in Nigeria and our experiences, my experience as a doctor and every other person's experience as a doctor, as a patient. I read it, I was interested. I was like, okay, what's the next step? To start looking for a job or a placement, a company where a health insurance company that I can apply to. And also, I'm saying this especially for those that are interested in transitioning into HMO. I'm also interested in knowing which of the department that I will best fit in. It's very important. That's for a start. Because in the HMO world, there are so many departments. We have the contact center, the underwriting department, the claims department, the medical service department, the finance department. There are several departments in the health insurance world. So I have to first of all find out which department would I fit in first. That would give me like an all access opportunity to learn about health insurance real time. And the department that I saw that would fit in best was customer service. Not as a customer service agent, but to supervise and run as a customer service. So 2020, I thought about it. I made the decision to resign from where I was working in the hospital. It was like a drastic decision. And that's looking about me. I had to make a lot of drastic and spontaneous decisions. But you might look drastic and spontaneous to a lot of people, but it's something that I've thought about most times for years or months. But I thought about it. But I just wake up tomorrow and say, tomorrow I want to implement it. And so people out there, they will think that, so let me just woke up and decide to make a drastic decision. Yeah, so that's how it looked like for a lot of people. Because when I was leaving, a lot of people were surprised because I never mentioned I was going to leave. I never spoke about it. So it felt like I was going to be there for a while. But I said I was going to leave and I was even leaving the next day. So I resigned. I think I briefly worked in a mobile clinic while I was applying for a health insurance company, and then I got my first ever job in the health insurance company, and I worked in that company for 5 years. It was an interesting experience, honestly. If you're interested in that story, you can comment and I will definitely talk about that story, but not in this video. If you're interested in hearing my experience in my first ever health insurance company that I worked in, you can just leave a comment, and then the more comments I get, I'll know that we're interested in it and I will talk about it in another video. So I applied, I got in as the head of customer service in that company. And in that company, I grew from the head of customer service to head of client retention because I started learning about how to retain clients, I started learning about sales. I was still practicing medicine because I was still monitoring the care that was being given to we call them enrollees, but they are patients in the hospital, enrollees in the health insurance world. That will be given to these enrollees slash patients. I ensured that the care was fair, was right, was accurate. If you're interested in health insurance, you want me to talk about it in detail, just let me know. I'm going to do another video for that. So I moved from client retention, from head of customer service to head of client retention. From head of client retention, I moved straight from that to I think head of sales, head of medical service. So I moved from head of medical service. My last position there was actually the COO slash head of business, head of sales, where I have to, all things operation and all things sales. before I moved to a different company that I'm in now. Currently, I'm working in a health tech slash health insurance company. We deal majorly with micro healthcare, but I think that's my journey. That's the summary actually of my journey from clinical medicine into health insurance space. So if you're interested in knowing more, like I said, just leave a comment and I would make another video about my experience working in a health insurance organization.